Hi, my name is Barry Doyle. I'm a nursing home abuse and neglect lawyer in Skokie, Illinois. I'm here today to talk about a citation that the Illinois Department of Public Health issued to the Grove of Fox Valley Nursing Home in Aurora after one of the residents there was admitted to the hospital suffering from a urinary tract infection, dehydration, and sepsis. Um, Most often in our blogs, we end up covering falls and bed sores and things like that. And those are issues that pop up relatively frequently. Those are also subjects which are covered by specific federal regulations. And in the nursing home setting, urinary tract infections are a fairly serious issue. Those can often be fatal for people who are senior citizens, and there are actually specific federal regulations that are in place regarding urinary care for nursing homes. There's basically three parts to the federal regulations that address urinary care. The first of these is that a resident should be catheterized only when necessary. The second part of this is that when a resident has a catheter, they need to be assessed for removal as soon as possible. And then the last one is that when a resident suffers from urinary incontinence, they need to receive appropriate treatment and services to prevent urinary tract infections. And all of these are really in place to prevent the onset of urinary tract infections. When a resident is catheterized, it really provides an opening by which bacteria and other infecting organisms can enter the body and cause a urinary tract infection, which again is something that is a really significant risk to the health and well-being of nursing home residents. So um, this particular resident who was involved in this citation had some issues which dealt with his urinary incontinence. He had neuromuscular dysfunction of the bladder and an enlarged prostate. Both of these things can lead to urinary retention. Urinary retention by itself sets up somebody to be at risk for developing urinary tract infections. When urine isn't cleared from the bladder, it tends to be a focal point for the development of bacteria, which can cause infections in the bladder and the urinary tract and the kidneys, and which is a serious risk to the health and well-being of the resident. So, this resident's doctor put an order in place to help address the risk of urinary tract infections. The order was that the resident was to have a bladder scan done twice a day. And basically, what a bladder scan does is it measures for the presence of retained urine in the bladder, and there's a way of measuring how much urine is actually in the bladder. And the doctor's order provided that if there was greater than 300 cc's of urine retained in the bladder, then the resident should be catheterized to drain the urine. The idea behind this, of course, is that by draining the urine, you're going to reduce the risk of developing a urinary tract infection. Ultimately, what happened to this resident is he's brought to the hospital. He is suffering from a urinary tract infection, from dehydration, from sepsis. And when the Department of Public Health went into the nursing home to review the records, this resident's particular chart, they found that there were multiple times where the scan that the doctor ordered had not been done. There were 10 days that were documented where the scan was done, and it showed that the resident had greater than 300 cc's of urine in the bladder. Now, according to the doctor's order, that should have resulted in the resident being catheterized to drain that urine from the bladder. But out of the 10 days where he was shown to have over 300 cc's of urine in the bladder, only 2 of those days was the actual catheterization documented as having been done. Um, there's a saying in the nursing home industry, if it's not documented, it's not done. There's absolutely no proof that the doctor's order was followed to have the urine drained for this particular resident, and this is the kind of thing that set up the resident to get a urinary tract infection, which the whole point of the entry of the order was to prevent the resident from developing the urinary tract infection. So, um, in the end, the nursing home was cited based upon its inability to show that the care that was ordered by the doctor was in fact provided. So, my name is Barry Doyle. We are happy to talk to anyone who is concerned about issues concerning nursing home abuse and neglect. You can call us at area code 312 263 1080. The call is free, and there's no obligation to hire our law firm if you do call. We're very interested in talking to families and residents who are concerned about nursing home abuse and neglect issues. Thanks for watching.